The Kansas City, Missouri Fire Department is mourning the loss of 2 members over the weekend. 60-year-old Captain Bobby Rocha died while hospitalized for COVID-19 Saturday morning. He was a 29-year veteran of the department. Then Sunday, 45-year-old Scott Davis had died battling the disease. He served Kansas City for 18 years. KMBC 9's Bianca Beltran has the story.
A solemn salute for a fallen firefighter. Many paid their respects outside of the communications center where Scott Davidson worked as a procession escorted him home to Wichita. Before answering 911 calls and dispatching help, he worked as a paramedic.
His longtime EMT partner who rode with him on the ambulance was here today, and I know how hard it's been for him and his family as well.
Jeff worked with Scott at Station 33 and knew him as a man of faith who loved his family.
His family would come up frequently and bring us cookies during the holidays, candy on Halloween. Scott and his wife Robin were around for the births of both my daughters. And so we have mementos at home from them, as part of their childhood.
Scott Davidson died from COVID-19 the day after Captain Bobby Rocha died battling the disease.
Everybody he met on the fire department quickly became friends with him. Big personality. And there are hundreds of men and women on this department mourning both Bobby and Scott.
Mourning and asking for help keeping people safe.
Just know that you may infect somebody who may infect somebody else, and that person may be a grocery store clerk, they may be a healthcare worker, they may be a first responder. And if you knew that that could lead to their death, would you still go out? Would you still not wear a mask?
That was Bianca Beltran reporting. Since the beginning of the pandemic, 201 members of the Kansas City, Missouri Fire Department have tested positive for COVID-19. There are currently 69 active cases. None are hospitalized at this time. Now, there is some good news when it comes to the COVID-19 positivity rate in both Kansas and Missouri. While the numbers are still high, they're falling. Kansas is now down to 19%. Meanwhile, Missouri is at 20.4. However, the daily number of cases continues to be staggering. In Missouri, it's almost at 4,600. In Kansas, the number is up to 7,500 since Friday. This afternoon, the hospital capacity in our area is improving, but there are still some major signs of trouble. Our Michael Mahoney has that story.
The issue is not the number of beds available. 40% of the beds in Missouri hospitals are open. In Kansas, it's about the same. The problem, having enough people to staff those beds.
Staff beds right now is the entire game. We're in a staffing crisis, not a bed crisis.
Hospitals are short on staff because their workers are getting sick too. Or in some instances, the workers have kids now back home because of the surge, once again doing distance learning.
They no longer are in school, so that could be impacting hours that they're able to work and the times they're able to work.
Steve Hager of the Mid-America Regional Council's Hospital Committee says the bed capacity problem peaked in the metro about 2 weeks ago. And he expects it to continue to improve this week since not many people schedule surgeries or hospital stays for a holiday week. But if there is another surge, as many fear, Hager thinks some hospitals may then consider reducing some services.
The only way to continue our level of care of patients if we're short-staffed is to reduce the number of people that we're taking care of.
So the main problem is not having enough hospital staffers to man the beds, rather than bed capacity itself. Michael Mahoney, KMBC 9 News.
The Kansas Hospital Association says some facilities are converting spaces to accommodate more beds if they need them and if they have enough people to staff them. This afternoon, another coronavirus vaccine is showing promising results. AstraZeneca says on average, its vaccine is 70% effective in clinical trials, but it also showed effectiveness of up to 90%. No hospitalizations or severe cases were reported in those receiving the vaccine, but unlike the other vaccines, this one does not have to be stored at ultra-cold temperatures, making it easier to distribute, especially in developing countries. The countdown is on this week in Kansas after Governor Laura Kelly issued a new mask mandate to go into effect Wednesday. It requires face coverings be worn inside public spaces, healthcare facilities, and on public transportation. It also requires masks outdoors when social distancing is not possible. Now, Kansas counties have the option to come up with their own mandate, but this time they can't completely opt out. One county without a current mandate is Miami County. Investigative reporter Matt Fleener is in Paola, where the county commission decided to reverse its stance to allow Governor Laura Kelly's order to take effect.
Miami County is one of 65 counties in Kansas without a mask mandate, but that changes now with a 3-2 vote of the county commission to allow Governor Laura Kelly's order to take effect on Wednesday. Here in this county, the county rolling average of daily new COVID cases has gone from nearly 4 cases to 17 in just 1 month's time. Governor Laura Kelly's order basically forces county commissions across Kansas to deliberately take action to opt out of the mandate at a time when cases and hospitalizations are rising.
The science says COVID-19 is real.
Monday was a packed meeting, some people wearing masks and some not, with people speaking for and against a mask mandate.
You can talk to a sheriff in any county in the state of Kansas. It's their job to uphold the Constitution, not decide the difference between a mask and the science thereof.
That's malarkey, because you don't have the constitutional right to go out and break the speed limit. You don't have the constitutional right to run red lights.
The commission's decision on Monday is a reversal of the county commission's decision earlier this year as hospitalizations continue to rise across the Kansas City area. Matt Fleener, KMBC 9 News.
Again, the statewide mask mandate is scheduled to take effect at 12:01 Wednesday morning. Today, the Cass County Commission issued a series of revised COVID-19 recommendations, not mandates, as the virus continues to spread through the county. Now, masks must be worn in public at all times. Gatherings have been limited to less than 10, and that includes family and friends. The county is also asking people to minimize travel outside the state. It comes as the positivity rate in Cass County averages about 18%. Right now, Kansas City, Missouri, Jackson County, Wyandotte County, and Douglas County are all under new coronavirus restrictions. All indoor gatherings are limited to 10 people. Restaurants, bars, and event venues must cap indoor capacity at 50% and close at 10 p.m. The Jackson County Health Department is offering free COVID-19 testing this week. Tomorrow, healthcare workers will be in Grandview at the View Community Center on Byers Road, and Wednesday you can get tested in Blue Springs at Vesper Hall on Northwest Vesper Street. Tuesday and Wednesday are walk-in clinic testing days, but health officials strongly recommend you register on the website before you go. As new developments, numbers, and mandates are issued, you can count on KMBC for all of your coronavirus coverage. We'll be posting updates on air, online, and on the KMBC 9 app.